Body dysmorphic disorder is a distinct mental disorder in which a person is preoccupied with an imagined physical defect or a minor defect that others often cannot see. Body dysmorphia affects approximately 1.7 to 2.9% of the population, a relatively small percentage, but a deeply impactful issue for those who struggle with it. That small percentage is made up of approximately 60% women and 40% men. The relationship a person with BDD has with the mirror is a huge factor. 80% of individuals with BDD will repetitively check their appearance in mirrors, often for a considerable amount of time, whereas 20% tend to avoid mirrors altogether. 85% of people with BDD are only concerned with their face and hair. The other 15% are concerned about the appearance of other parts of their body. People with and without BDD experienced an increase in distress and self-focused attention upon exposure to a mirror. BDD spikes around adolescence. A huge percentage of adolescents use social media as their form of entertainment. It was found that the frequency of use of image-based platforms is significantly and positively associated with body dysmorphic symptoms. Social media is full of many different people posting their perfect bodies. Comparison is a huge factor when dealing with BDD. The biggest areas of concern for teens around the age of 16 are acne and acne scars, and stomach and nose shape. Any part of the body could be involved in BDD. People with BDD are often concerned about the symmetry of their bodies. They may feel that something is too big or too small, or out of proportion to the rest of their body. The behavior of BDD sufferers will include some or all of the following: checking the appearance of a specific body part in mirrors, camouflaging a perceived defect with clothing or makeup, picking their skin to make it smooth, picking the skin around a perceived defect, comparing the appearance of a perceived defect with that of others, dieting and excessive exercise or weightlifting, avoiding social situations in which a perceived defect might be exposed. BDD brings much shame to a person, which causes a 10-year delay from symptom onset to help seeking. Suicidality is 45 times higher than in the general population. 60% of young people between the ages of 12 and 18 who have BDD are either not attending school or go sporadically. BDD is a real issue in people's lives. Although BDD can affect a person's life in many ways, the likelihood of recovery from BDD is relatively high at 76%. Cognitive behavioral therapy is the most effective treatment. BDD is not always identifiable within a person. Behind every face is a story, one that deserves to be seen, understood, and met with compassion.